When 3-week-old Ashlyn Julian came in with an aneurysm, or brain bleed, neurosurgeons at the University of Kansas Hospital were faced with an emergency few doctors had seen before.
This is an exceptionally rare problem in a patient so young, and her specific aneurysm and the way that we treated it has never been described before. The reason we were able to do that is because we have the tools and technologies and the minds around that can be creative in an extremely challenging situation.
This is the power of academic medicine.
Well, when you get the diagnosis of cancer, it is a brain lockdown. You're scared to death in so many different levels.
When Teresa Walsh came to us with cancer of the jaw, multiple stages of treatment were required, including surgeries and radiation.
The primary focus here is on quality care.
Absolutely.
And we see it, we've experienced it, and the results are second to none. It's a world-class institution.
The University of Kansas Hospital has been ranked by U.S. News & World Report among the best hospitals in the country for 10 consecutive years. We are also in an elite group of fewer than 20 hospitals ranked nationwide by U.S. News in most specialties. Thousands of people put their lives in our hands each year. The number of patients cared for at the University of Kansas Hospital has increased dramatically year over year since 1999, and it's projected to grow another 30% in the next few years. The demand for neurosciences, surgical oncology, and ear, nose, and throat procedures is expected to increase nearly 40% by 2020. That's why we're building the new Cambridge North Tower. The 550,000 square foot structure will have 11 new operating rooms to increase capacity for life-saving complex surgical procedures. Nearly a fourth of the 124 beds will be for intensive care patients who need the highest level of critical care. And more than 600 new physicians, healthcare and support staff will be hired to treat the additional patients.
The new Cambridge North facility will bring together the best clinicians, the latest therapies and technologies, and cutting-edge research so that each and every patient has the best possible outcome. As the region's premier academic medical center, that's our job.
James Wade was just a teenager when he was diagnosed with cancer of the salivary gland, a condition accounting for less than 1% of newly diagnosed cancers each year.
We see some of the most challenging cases here at the University of Kansas Hospital, and frequently these cases involve many different team members of different specialties involved in the care of a single cancer patient. We are engaging in this capital campaign to really allow and afford the better access for these patients to get multidisciplinary care for these very, very complex cases.
The University of Kansas Hospital receives no local or state funding. Its growth has come from reinvesting its revenues and from generous gifts from patients and supporters. Annette Block's $10 million challenge grant accelerated fundraising for Cambridge North Tower and reflected the urgency of the expansion. Her gift inspired others, including 100% of the hospital's board and leaders, as well as an overwhelming number of its doctors and staff, who have made personal contributions. And still more gifts are needed.
I hope others in the community will follow our lead and give money to the University of Kansas Hospital and feel as good about it as we have.
To be a great city means we need world-class healthcare. And we have that already in so many ways in the University of Kansas Hospital. But it is time to take the next step.
The demand for our services for the sickest of the sick patients continues to increase and will increase for the foreseeable future. As the only academic medical center in the region, it is our responsibility to provide that care. And quite frankly, there's no other provider that can offer the caliber of services that we do for that patient population. Your support is critical for our ability to be able to meet the needs of those patients in the future. Someday that may include you or a loved one.
Your generosity supports medical innovation and provides advanced treatment for patients with no other options right here in Kansas City, and that improves the economic health of our community. Be a part of saving lives. Visit giving.kumed.com. and learn how you can support the medical breakthroughs happening here. This is Academic Medicine.